All right, let's tackle the diuretics. We're talking about diuretics and cardiovascular disease. We're talking about medications. So the diuretics are very confusing. I'm still confused by them, but loop diuretics, they're basically, these are the water, they call them water pills, and they don't really like to call them diuretics anymore. They've got the different words for them now, but these will interact with the pain medications, the over-the-counter pain medications I talked about in the other video. Remember what I talked about? NSAIDs, non-steroidal anti-inflammatory medication. Okay, so we can get those over the counter in the form of Advil, things like Tylenol, things like that, naproxen, Celebrex, stuff like that, okay? So just keep an eye out, because actually those can decrease the effect of the loop diuretics. So you've been taking, something for chronic pain, for example, you just take 3 Advils a day. Maybe talk to a doctor about that. But also if you start a loop diuretic, just make sure your doctor knows what over-the-counter medications you're taking, as well as your prescriptions, right? Because the more the doctor knows about you, the better able that doctor is to give you excellent care. Watch for early signs of gout. You know what gout is? So that's where in the toe, oftentimes in the big toe, sometimes the top of the foot, sometimes in the hands, sometimes in the ears, very rarely in the ears. It'll get hot, it'll get purple, red, throbbing, it'll hurt. Some people have said that it's like a hot poker touching their foot. It's not fun, it's not pleasant at all, but it's also not terribly dangerous, but it's just really unpleasant. And so if you've started a diuretic and you're starting to get toe pain or foot pain, you want to tell your doctor about that right away, because it might be that one of the side effects could be that you're getting some signs of gout, and maybe that you were susceptible to it anyway, and maybe just a medication put that over the edge. And it's really not that the medication is the problem. It could be that you had an underlying problem and now you probably need to treat the gout. So there's many ways to do that, but I want to do a side note here. I know I'm talking about cardiovascular, but when it comes to gout, it doesn't always need a medication. Not always. Come see me. I can pull on the heel. I can stretch those calf muscles out. And oftentimes, if we can get the muscles in the lower leg and foot to release, the gout starts to go away. So there's lots of treatments for gout, but that's one thing to consider. Not a recommendation, but one thing to go and talk to somebody about. Thiazide diuretics, that's your hydrochlorothiazide. That's your more common one, okay? Thing about these water pills is that they decrease blood pressure, but they also do things to our electrolytes of the body. Now, what are our electrolytes? Calcium, potassium, sodium, and magnesium. And so what happens when we have low magnesium? We get muscle cramps. What happens when we have low potassium? We get muscle cramps. We don't want potassium and magnesium going too low, which is why what you'll notice on your lab work that your doctor's monitoring is that you'll see sodium, potassium, and magnesium and calcium checked off on the lab requisition. And there's good reason for that. They're monitoring and making sure that your electrolytes are doing okay. So there's no need to take any electrolyte formulas unless your doctor or your naturopath has said so. But sometimes it's a matter of just looking and making sure everything's okay. You've got your potassium-sparing diuretics. And what does that mean? Well, it means that it doesn't take potassium out of the body. So in that case, if you're on a potassium-sparing diuretic, definitely want to avoid taking a potassium supplement, unless your doctor or naturopath has said that that's okay. One thing about potassium-sparing diuretics is if you're noticing, if you're a man and you're noticing that you're actually getting some breast tissue here, it's like, oh, I think I'm getting boobs. That is one of the side effects, okay? So again, just take a look. Just monitor for those things and go, oh, is that, am I just getting a little chubby, or is there something going on here? And it could be that you're having some sort of adverse effect to something. If you're taking an NSAID regularly, let your doctor know about it. And what's an NSAID? Advil, Celebrex, naproxen, Tylenol, those over-the-counter painkillers. Okay. What else? Blood thinners, blood thinners, blood thinners, blood thinners. Okay, what do we want to look at when it comes to blood thinners? Well, when I see a blood thinner on my medications list, on my new patient intake form, I pay close attention because blood thinners probably are one of the medications that interact the most with herbs. Okay, so yes, a blood thinner does definitely limit my ability to provide herbs to people. And that's okay. There's lots of different ways to get good care from a naturopath besides taking herbs. The other thing about a blood thinner is that it's about vitamin K. There's one vitamin that you have to be careful, not be careful of, but just be aware of with blood thinners, and that's vitamin K. Not that vitamin K is bad. Vitamin K is needed for like healthy bones and for our blood to clot properly and things like that. But the thing is that when we're on a blood thinner, our doctor is monitoring very closely and working very hard to make sure that our platelets, like our blood clotting, is exactly right. And they're going to be dosing us very, very specifically with a blood thinner. They're going to be watching us very closely. We get a lot of good care when it comes to taking blood thinners. And so what they might say is, don't go on a great big, green juice fast, which means that you're having a lot of kale, a lot of spinach, a lot of greens, a lot of dark leafy greens, because they're a very rich source of vitamin K. Now, it's not the vitamin K, it's the problem. It's the drastic increase in vitamin K that's the problem. Or the drastic decrease. And so if you were used to taking green juice every single day and then you stopped all of a sudden, then that could affect how much of the dosage that you need of your blood thinner. And so that's something I want you to be aware of is dark green leafy vegetables. To have a kale salad, like that's okay. But if you've never had kale before and all of a sudden you're like having it every day and you just got on a blood thinner, that actually could affect the blood thinner and affect the dose you need. And so it's don't go on big old greens parties and then stop and then start again and stop. It's just a matter of gradually increasing something, because when it comes to cardiovascular medications, big ups and downs of anything I find are problematic. But you should do a nice slow, just take it slow, right? Go up the stairs slow, eat your kale, have your green juice slow, slowly increase and implement those healthy strategies in a very intelligent way, but don't be rushed about it. Take your time. Let your body get used to it. Okay? And talk to your doctor, talk to your naturopath, make sure they know what you're doing. Because some of these things, right, and that's the thing about these videos, is you're like, oh my God, there's so much, but I'm giving you the highlights, and so there you go, you got the highlights. Go ask your doctor more questions, go do some more research, go get yourself a naturopath, come and see me, and we'll navigate this.